Hello, my name is Brook Ward. I'm the President CEO of the Washington Health System. It's my honor to be back with you again as part of our Friday video series where we attempt to update you about what's going on at our health system and the environment around us. Unfortunately, every one of my updates today is COVID related, so let me get right into it, starting with the number of COVID cases. If you've been watching the news, you know the number of cases, hospitalizations, and deaths have been going up across the country within the Commonwealth and locally as well. For the time period of November 20th through the 26th, the number of people who tested positive during that time period rose to around 12% of everybody who got tested. And it's actually higher in our local area. From March through the end of September, we were seeing around 2.5% positivity rate. In the month of September, it was up to 11%, and now in November, it was up to 25%. So about 1 in every 4 people who's walking around is positive right now. That, of course, has increased the number of people who need ED and hospitalization, which is driving up the rates. And of course, if you heard the reports, there were 1.2 million people, according to TSA, who flew over the holiday weekend. And of course, many more people got together with extended family and friends over the holidays, potentially exposing each other, which could make the situation worse in the month of December. So that leads to the question of, are we prepared and do we have capacity? At the Washington Hospital, we have 260 adult acute care beds, and as of this morning, we have 140 people using them, so we have some capacity. At Green, we have 23 beds, and of course, we only have 10 people admitted down there. And of all the people we have admitted at both hospitals, only about 16% of them are COVID positive. So that's the good news. The bad news is that 16% is a larger number. So going back earlier this year, from March through the end of September, we averaged anywhere around 3 or 4 positive inpatients per day. There were times where it spiked up to 7. There were times where it was as little as 0. But on average, it was 3 or 4. In the month of September, that went way up over 20 inpatients per day. And in November, it's averaging well over 40. And I'm getting concerned about what happens when it goes over 50, 60, and 70. And we'll deal with that when and if it happens. Now, we have plans, contingency plans, to expand the number of beds, ventilators, those kind of things. But we haven't had to implement any of that, thankfully. So then the next question people ask is, are there any limitations as these numbers go up? And really we're experiencing 2. One has to do with people and the other one has to do with lab supplies. So let me talk about people first. Every hospital across the country, because of what's been happening with the economy, cost cuts in healthcare, etc., has been cutting expenses wherever possible on every level, including personnel. And long gone are the days where hospitals staffed extra people just in case there was an emergency. Back in the day, there was extra people, so if there was a major bus accident, there was people there to take care of them. Now, we staff for our normal volume, and if there happens to be a bus accident with a lot of victims, God forbid, the group comes together, we work as a team to take care of them. But what's been happening in the country now is we've had a bus accident that started in March and is still going. And so it's a struggle, particularly as these numbers go up, to try and care for these people because there's not extra nurses just sitting around waiting for work to do. And so if these cases continue to go up, we might be forced to have to either shut down, limit, or slow down some of the outpatient services we provide to bring that staff in and take care of people at the bedside. That's the dilemma we're going to be facing soon, and that's one of our capacity limitations. The second one is around COVID testing, and it's not the supplies you're thinking of. It's not the swabs that you take the specimen with. It's actually the supplies that the lab uses to run the specimen. It's the reagents for the lab equipment. As far as I'm concerned, based on what I've seen here with our experience, our reagent supplies for COVID testing is no better now than it was back in April. And that's the limiting factor. With the number of people who need a COVID test going up, that's causing a problem. We don't have enough reagent supplies to run those tests in-house, and we're sending them to Quest, and they're running out as well. Matter of fact, before the holidays, Quest sent us and every other one of their customers, hospitals in the area, a memo telling us to stop sending asymptomatic patient samples to them because they don't have enough supplies to run them. So those are the 2 limitations we're running into. Now, there are those of you out there who need a COVID test and you're asymptomatic and we might turn you away. And it's not because we don't care. It's because we're trying to prioritize those supplies for the people who are truly sick and need that result. And unfortunately, we'll have to turn some of those asymptomatic patients away at this point. Moving on then to respiratory clinics. You heard me talk about in some prior videos the fact we're going to set up some respiratory clinics. These will be dedicated to patients who belong to the Washington Physician Group, physician practices, or the residency practices. And what we're planning to do with these is if you have common cold, strep, flu, or COVID-like symptoms, instead of coming in to see your physician at the physician office, instead we will schedule you to go to these respiratory clinics where they will see you there, determine what your illness is, make sure you're safe before they send you back to your normal primary care doc. These will be staffed by our employed physicians. It could be your physician or it could be a peer of your physician, but either way, they're going to be great, highly talented individuals with the appropriate equipment and supplies to take care of you safely. Once they rule you out and make sure you're safe, then they can send you back to your normal primary care physician. We're going to have one set up at Neighbor Health Center in Washington. That actually started operations this week, and we're already seeing patients. We're going to have a second one down in Waynesburg at the Washington Health System Outpatient Center. That'll be going next week, along with the pediatric clinic, which will start next week as well. So the way to get access to those is if you're a patient of one of our employed physician groups and you have those signs and symptoms, you'll call the normal physician office line to schedule, and they'll route you to that clinic to be seen. Changing gears then to hospital visitation. Unfortunately, last week on Thanksgiving Day at 6 p.m., we had to re-implement our strict visitor policy that we had in the spring, which allows no visitors for inpatients. There are two exceptions for this. One is for people at end of life and for clergy at end of life based on administration approval in advance. The only other exception is for women who come and deliver a baby. They're allowed to have one person to come in and assist them in the labor. That person can stay the whole day, but there's no trading out. That person has to stay. If they leave, they're not allowed back in. Those are the policy in place right now. Now, we understand and we know that that's extremely tough on not only the patients, but their family. And we're not doing it to be difficult on them. We're doing it to keep not only the patients who count on us to keep them safe, but our staff safe as well. If the cases, positive cases in our area go down, then we can loosen up the visitor policy again. But right now it's extremely tight, and I apologize in advance. Now, I'm getting a lot of questions about vaccines and vaccinations, and will the Washington Health System be ready to vaccinate the public? Where will we do it? Those kind of things. And unfortunately, we're getting little to no information from any level of government. All we're being told is to be prepared to do it pretty quickly. So I want you to know here within the health system, we're preparing not only to house, distribute, handle, and administer the vaccines when we get them. Now, we don't know which vaccine we'll get, which product, those kind of things, but we're preparing for all scenarios. And it's most likely going to be administered on an outpatient basis at our occupational medicine, our primary care clinics within the Washington Physician Group, and our residency offices. We'll start, of course, with our own employees who will be in the first wave as healthcare employees, and then we'll roll that out to the rest of the community based on the government's guidelines when they tell us what that is and when we get the vaccine. So more to come in this. I just want you to know we are focused in trying to get prepared as much as possible with the little we know. Moving on then to your safety. I want to remind everyone who's watching, you need to be diligent. This thing is long from over, and so you need to continue to remember wear a mask. That needs to cover both your nose and your mouth at all times, anytime you leave your house. The cloth mask should have at least 2 layers of material. Remember to wash it frequently. Remember, social distancing and remaining 6 feet apart continues to be extremely important. Avoid large crowds when you can. Remember to wash your hands frequently and avoid mass transit and travel whenever you can as well. Now, if you're experiencing any kind of COVID symptoms, remember you need to, or around someone who is COVID positive and have an exposure, remember you need to go in isolation and self-quarantine immediately. Call your healthcare provider to get instructions. Your healthcare provider may order a COVID test for you, and they'll give you instructions as to where to go to get that done. You also need to remember that you not to walk into a physician offices. We're having patients who don't have an appointment who come in, and that's causing some issues as well, because then they potentially expose our staff and other people there. And so remember, please schedule an appointment. If you do need an appointment, whether you're COVID positive or not, frankly, remember we can do that via telemedicine as well. So you don't have to leave your home. We can do it in an environment that keeps you safe. But in all cases, call your physician offices to schedule that. If you're experiencing a medical emergency, remember to call 911 immediately or proceed to the closest emergency room to be taken care of. And if you're having COVID-like symptoms of any type, please call them ahead of time so they can prepare for your arrival to make sure that you and they remain safe. Lastly, I just want to remind you, whether you're having COVID or not, COVID symptoms or not, please don't avoid other medical illnesses, diseases, or emergencies. We know in the last 6 months, there have been people who put off serious healthcare issues because they were concerned about coming in and being potentially exposed to COVID. And that delay has actually caused them more harm than the other. And so, as you heard me say earlier in the video, the vast majority of the people who are here that we're taking care of have nothing to do with COVID. And so please know that we have a safe environment to take care of you. That's what we're here for. And we want to make sure that you don't put off needed care when we can take care of you in a safe environment. Thank you for watching this video. I hope you found it useful and informational. Because the number of COVID cases have gone up, we're actually reducing the number of other videos we do right now just to keep those people safe. I'll be back on December 18th to give you another update. So until then, stay safe, enjoy December, and we'll see you then.